In 1978, former Chinese leader Deng Xiaoping introduced market-oriented reforms that transformed China's economy and accelerated industrial development. However, these economic changes also led to the emergence of income inequality. Rapid economic growth widened the gap between social classes. And as economic disparities intensified, China's Gini coefficient rose from 0.16 by 2007. The Gini coefficient had increased to 0.469, resulting in urban residents earning approximately 3 times more than people living in rural areas. To prevent income inequality from continuing to rise, China should focus on improving the living conditions of younger generations in rural regions. One effective solution is to provide better educational opportunities for children. This approach would allow more students to participate in the national college entrance examination, succeed academically, and secure financially stable employment. As a result, income levels could become more stable across society. A similar situation occurred in Britain during its period of industrialization, when a significant divide existed between social classes. To prevent this gap from worsening, Britain introduced educational opportunities for working children, which marked an early step toward greater equality. According to a researcher from National Central University in Chongqing, income inequality can be reduced in the future through expanded access to education. Nevertheless, although education represents a symbol of social equality and income mobility, an excessive expansion of higher education may also contribute to increasing income inequality. For example, the government allocates approximately 1,000 RMB per month to teachers in urban early childhood education, while teachers in rural areas receive only around 3,000 RMB per month. Data from the Rural Education Action project affiliated with Stanford University shows that only 2% of students from rural areas are able to enter college, and only 8% of junior high school graduates continue on to high school. Therefore, it is essential to balance educational resources between urban and rural areas in order to promote income equality. Income inequality has emerged as one of the most significant structural challenges facing contemporary China, particularly in the context of rapid economic growth, market-oriented reforms, and large-scale urbanization. Since the introduction of economic reforms in 1978, China has undergone a profound transformation from a centrally planned economy to a market-based system, resulting in remarkable increases in productivity, employment opportunities, and overall national wealth. These reforms successfully lifted hundreds of millions of people out of absolute poverty and significantly improved living standards for a large portion of the population. However, despite these achievements, economic development in China has been accompanied by widening income disparities across regions, sectors, and social groups. Urban residents, especially those living in coastal and metropolitan areas, tend to benefit disproportionately from higher wages, better infrastructure, and more comprehensive public services, while rural populations and migrant workers often remain at a disadvantage. As a result, income inequality, commonly measured by indicators such as the Gini coefficient, has increased over time, raising concerns about social cohesion, fairness, and long-term sustainability. In this context, access to education and healthcare has become a critical area of analysis, as these two sectors play a central role in shaping human capital development, social mobility, and intergenerational equality. This video focuses on examining the association between income inequality and access to education and healthcare in China, arguing that unequal income distribution is closely linked to unequal access to these essential public services. which in turn reinforces broader patterns of social and economic inequality. The relationship between income, inequality, and access to education in China is shaped by institutional structures, regional differences, and household income levels. Although compulsory education is officially guaranteed, significant disparities remain in educational quality. Urban schools benefit from better funding, facilities, and qualified teachers, while many rural schools struggle with limited resources and staff shortages. Children from low-income families are less likely to receive quality early childhood education, placing them at an early disadvantage. As education levels increase, these gaps widen, as wealthier families can invest more in tutoring and exam preparation. High-stakes examinations, such as the Gaokao, are strongly influenced by family income and location, limiting access to higher education for disadvantaged students. As a result, unequal access to education reinforces income inequality across generations. This chart illustrates the distribution of income across different income groups in China before tax. Using data from the World Inequality Database, it provides a clear picture of how income has been shared among the top earners, the middle class, and the lower income population over time. First, I would like to draw attention to the top income groups shown at the upper part of the chart. The top 1% of earners in China receive approximately 13.7% of total national income, while the group between the 90th and 99th percentiles accounts for about 25.1%. Combined, the richest 10% of the population control a significant share of the country's income. This indicates that economic growth has disproportionately benefited high-income groups, particularly in recent decades, as China's economy expanded rapidly. In contrast, the middle 40% of the population receives around 42.9 to 47.1% of total income. Although this group holds the largest single share, its income proportion has remained relatively stable over time. This suggests that while the middle class plays an important role in the economy, it has not experienced the same level of income growth as the top earners. As a result, the income gap between the middle class and the richest groups continues to widen. At the lower end of the income distribution, the bottom 50% of the population receives only about 6.5 to 15.7% of national income, despite making up half of the population. This group controls the smallest share of income. This reflects a clear imbalance in income distribution and highlights the persistent challenges faced by low-income households, particularly in rural areas and less developed regions. Overall, this chart demonstrates that income inequality remains a structural issue in China. While economic growth has improved living standards for many people, the unequal distribution of income suggests that the benefits of development have not been shared evenly. Income inequality also exerts a profound influence on access to healthcare services and health outcomes in China. Over the past decades, the Chinese government has made substantial efforts to expand basic medical insurance coverage, aiming to reduce the financial burden of healthcare for the population. While these reforms have improved overall access to medical services, significant disparities remain in the quality, availability, and affordability of healthcare across different income groups and regions. High-income individuals living in urban areas typically have access to large, well-equipped hospitals, advanced medical technology, and highly trained healthcare professionals. In contrast, rural residents and low-income households often rely on underfunded clinics with limited medical staff and outdated equipment. Financial constraints, combined with long travel distances and limited health awareness, may lead low-income individuals to delay or avoid seeking medical treatment, even when facing serious health conditions. These barriers contribute to unequal health outcomes, including differences in life expectancy, maternal and infant mortality rates, and the prevalence of chronic illnesses. Poor health further limits individuals' capacity to participate in education and the labor market, reducing productivity and income earning potential. As a result, health inequality not only reflects existing income disparities, but also reinforces them over time. This creates a vicious cycle in which low income leads to poor health, and poor health, in turn, restricts opportunities for education and employment, thereby perpetuating income inequality across the life course. In conclusion, income inequality in China is closely linked to unequal access to education and healthcare. Differences in household income and regional development significantly influence individuals' opportunities to acquire quality education and medical services. These inequalities limit social mobility and contribute to the intergenerational transmission of disadvantage. Addressing income inequality, therefore, requires not only sustained economic growth, but also targeted policies that promote equal access to essential public services. By strengthening educational and healthcare systems, particularly in disadvantaged regions, China can move toward a more inclusive and balanced development model.